Okay, so in this discussion, we're going to look at drug names, classification, and safety. So again, it's really important that you kind of be able to recognize now as an athletic trainer, you're not going to be able to know the name of every single medication that you might encounter. However, it's good to be familiar with some general terminology and be as familiar with as many drugs as possible. So this chapter is going to look at how drugs are named according to different types of names, and it also looks at different types of classes of drugs, and we're also going to look at some safety issues with drugs as well. So when we look at drug names, so all drugs have what we call a generic and a trade name. Okay, so this is what you're going to be seeing. So, and if you go to any type of pharmacy and you see a lot of the over-the-counter drugs, you'll see this. You'll see the kind of name brand drugs, and you'll see what we call the generic drugs. Okay, so the generic is the name that's actually registered with the United States Pharmacopoeia National Formulary, and it's lowercase and typically in italics. Okay, so again, this is basically, and it's sometimes a version of the drug's chemical name. So that's something you'll see. Over here we have then the trade name. This is the legally protected. These are the drugs that have legally protected patents, and it's going to start with a capital letter. Okay, so the trade name is a proprietary legally protected name. Okay, so in other words, so a generic, so example with aspirin, for instance. Aspirin is a generic drug. There's brand names for it. So for instance, Bufferin is the name of as a trade name for aspirin. Okay, so you basically have like what we'd consider the brand names and the generics. Now there's factors regarding generic and trade names. So again, there has to be bioequivalent. So generic drugs have to have the bioequivalent of the drugs with the trade name. So for instance, when you buy naproxen sodium, that's your generic for Aleve. It has to have the bioequivalence for it. So it has to meet the same standards. So what the patent basically does, so there's when a company comes up with a drug, they get a patent. They basically get property rights during the development of the drug. And what ends up happening is there's exclusivity. So for 20 years, a drug it has to have the drug trade name before producing a generic. So what that basically does is, it prevents generic drugs from being put out right away. So in other words, initially, when a drug comes out, it's only available via the trade name, and then after the 20 years, the exclusivity is expired, then the drug can be available via generic. Okay. Now you can have a situation where, for instance, most of the prescription drugs written in the United States are for generic drugs. In some instances, the physician may not want a substitute, so the prescriber can request that the pharmacist not substitute a generic brand for a branded medication. Okay, so if the physician does not want a generic, they could put in their order to not substitute. Okay, so again, difference here between generic and trade name, and we look at why we have a generic versus a trade name and what the patent means. So again, these are important points to know when you're kind of understanding different drugs. So here's some examples of generic and trade names. So if you just kind of look at this list, and this are the examples taken out of your text. So you have the generic name, you have the trade name, and then they're just showing you here what the indication is for. So for instance, a very common drug used, a short-acting beta-2 agonist for asthma, albuterol. The trade name for it or brand name, Ventolin, Proventil, ProAir. Okay, so again, and typically again the generic versions are cheaper. So many times unless the physician puts a do not substitute, many times the pharmacy will substitute the generic for the trade name. So as we look at drug classes, so again, drug classes are just a standard manner of kind of classifying medications. So basically, when in a drug class, you'll have medications, or other compounds that have similar characteristics. So drugs get classified based on the mechanism of action. So in other words, they basically bind to the same biological target and produce a similar effect. You have the chemical structure that's common, so that's another way drugs can get classified, and you have classification based on therapeutic indication. Okay, so many drugs are classified in more than one class. So, and typically when we look at therapeutic effects for medications that are very common in the athletic training setting, so we look at drugs obviously to treat pain, drugs that are used to treat inflammation, drugs that are used to treat infection. They're probably some of the more common drugs that we encounter in a sports medicine setting. So those are different types of classifications of drugs, and there's within those types that I just discussed, there's various types that have some different mechanisms of action. Okay, and again, you could also kind of classify drugs based on body systems that they treat. So there's a bunch of different drug classifications, again, just based upon how they kind of put the drugs together. Now kind of looking at drug safety. So again, drug safety always involves assessment of risk versus benefit to the patient. So in other words, basically the risks of taking it, all drugs, do carry risks with them. They could have adverse effects. But you kind of weigh the risks and benefits. In other words, can the drug potentially have a larger benefit to the patient? Okay. So when we look at this, so we look at drug efficacy versus effectiveness and what they are. So efficacy is the drug's capacity to produce an effect. Okay. So basically, the efficacy is measured under supervision in a group of patients who are most likely to have a response to the drug, and that's usually done obviously in a controlled clinical trial. So that's just basically the drug's ability to produce an effect versus effectiveness was how well the drug works in the real world. Okay. So that's the difference between efficacy and effectiveness. Now, it's important to note a drug can have high efficacy, but it could have low effectiveness. Okay, so these two things don't necessarily have to coincide. So it's not like every drug is going to have efficacy and effectiveness. Sometimes a drug could have high efficacy, but may have low effectiveness. So in other words, maybe there's a drug that works, but has a lot of very adverse side effects. And that could be something that, for instance, would cause the patient to stop taking it. So while the drug has the ability to produce an effect, kind of how well it's going to work in the real world for a patient might not be good because they might stop taking it because they don't like the adverse effects. Okay, so these are some of the factors involved in patient compliance. Again, probably two of the bigger things you see is one, drug interactions, and this is why it's important to kind of know what other drugs the patient's taking. Also to kind of make them aware potentially of what other drugs to not take, particularly if there could be drug interactions with over-the-counter drugs. So the last thing you'd want them to do is they get a prescription drug and then they think they need an over-the-counter drug for something, and it's an over-the-counter drug that has an interaction with their prescription drug. And obviously adverse effects. So it's probably a big reason why a lot of patients sometimes become non-compliant is because of the adverse effects of some drugs. Now, there are some factors that do kind of help, that can help patient compliance. There's also things that could hinder patient compliance. So, again, when we look at some things with patient compliance, so in other words, inadequate selection, treatment, communication. So these are different things that could affect patient compliance. So we want to make sure that, again, there's good communication. So again, patient-provider relationship is very important. Make sure that the drug selected is obviously going to be beneficial to the patient. Make sure the patient is well aware of the treatment, what to expect. And again, the communication is just going to help. Again, if the patient has positive expectations, many times that certainly can enhance the treatment and can enhance compliance. Keeping an open line of communication, making sure that if they have problems, they're able to voice that to you so that in the case of maybe a drug does have to get changed, it gets changed. They don't just stop taking a drug and then don't seek out any other type of treatment. So make sure that those lines of communication remain open. Okay, so looking at some terminology, so looking at the idea of therapeutic index. So the therapeutic index range is the range between what we call the efficacious dose and the dose that causes adverse effects. Okay, So basically, how much of a dose do you need to get a benefit from versus how much could potentially cause an adverse effect? And what you want there with most drugs, so a drug that's typically very safe will have a wide therapeutic index range, okay? Or you also hear the term therapeutic window. You want a wider range, okay? So in other words, if the dose is, if the dose that is efficacious is far away from the dose that causes adverse effects, typically that's a pretty safe drug. In other words, there's not a lot of negative effects associated with it. So if they have an extremely high therapeutic index range, they're very safe. Okay. Now, if they have a narrow range, they still maybe need it, but there's much greater chance of adverse effects. So people typically have to be followed a little bit more closely with them. There's also more likely to have possible food-drug interactions. So you see this many times the case with a lot of antibiotics. There's certain antibiotics that you have to be careful with when taking food. So for instance, calcium in your dairy products could affect the bioavailability of certain antibiotics. So then again, that's something that comes with a narrower range when we're talking about therapeutic index. So again, big thing you need to know here is if therapeutic window is wider, the drugs tend to be extremely safe, not a lot of negative effects because that efficacious dose is so far away from the dose that causes a lot of adverse effects. The narrower the range, they're more likely to have negative effects. They tend to need to be followed a little bit more closely to make sure that the drugs aren't causing any problems for the patient. And when you look at another thing that kind of looks at it is what's called the margin of safety. So again, the therapeutic effect of any drug is always balanced by the potential lethality or the toxic effect, and that kind of yields that margin of safety. So again, that's something that's taken into consideration when an individual is going to get prescribed a particular drug. So some other terms that we also look at when we talk about, again, safety, whether, whether the risks are better than the benefits is what's called the numbers needed to treat. So numbers needed to treat looks at, it's an epidemiological term. It's basically the number of patients who need to be treated in order for one patient to benefit. So in other words, how many patients with a certain condition need to be treated for the drug for one to benefit. So this kind of goes towards some of the safety and risk profiles that you look at. And then the other one, which we use numbers needed to treat, the other thing we use to calculate based off that is what's called the number needed to harm. So basically, the number needed to harm is when we start to look at adverse effects. In other words, how many individuals will start to have adverse effects, or how many people, when treated, will show adverse effects. So those are some numbers that when you're trying to look at developing risk benefit to whether a patient should be treated with a drug, these are some of the numbers that are used epidemiologically to determine that. The other thing we do is we look at developing risk profiles. So one thing to note is that numbers needed to treat is based on changes of absolute risk. Okay, so when developing risk profiles, you have absolute risk, so that's a factor in calculating numbers needed to treat. Relative risk is actually the difference between the numbers needed to treat and the numbers needed needed to harm, or in other words, a number that would be needed to treat it for adverse effects. So many times benefits are reported as relative risk reductions because it does tend to make a drug look more effective. And typically, in contrast to that, adverse effects are usually reported as absolute risk increases because they make a drug appear safer. So again, sometimes these terms are used in different ways. So again, these are all things that in numbers that people look at as far as when we're kind of looking at therapeutic index and the different safety profiles within drugs. So in looking at adverse drug effects, so when we look at adverse drug effects or an adverse drug event, this is an injury that results from medication use. Some adverse drug effects are caused by preventable errors. So sometimes they can be caused by just mistakes that get made with how the drugs are taken. adverse drug events that are not preventable, which are often the result of what we call adverse drug reactions. So these are things that compromise therapeutic efficacy or increases toxicity of the drug. So, and again, some of those could be dose dependent. Again, drugs, we kind of talked about the idea behind drugs that have a narrow therapeutic index. Some drugs people just have allergies to. And they're not, allergic reactions aren't necessarily dose related, and they typically do require exposure to the medication. And then some things could be what we call idiosyncratic. This could be an unexpected adverse drug reaction. So those are not dose dependent or allergic. And they could just be a genetically determined abnormal response. So they could be something that isn't really expected from the particular drug, that just, because the individual just has a different interaction to the drug that is taken. So here's a table just outlining adverse drug reactions of different drugs. So going mild, moderate, severe, lethal. So they kind of talk about some of the things that are very common. For instance, in a mild situation, there's no antidote or treatment required. Hospitalization is usually not prolonged. So for instance, something like antihistamines. Some antihistamines have a tendency to produce drowsiness. Opioids could cause constipation. Moderate, there typically needs to be a change in the treatment, not necessarily a discontinuation of the drug. So typically what they'll do in the case of a moderate adverse drug reaction, they'll just look to modify the dose or maybe add a different drug to try kind of counteract. Again, there may be hospitalization that may have to be slightly prolonged. In severe instances, this could be potentially life-threatening. This is usually where a drug needs to be discontinued. And again, there's some examples there of some drugs. So again, take a look at this full table to see this. Obviously, lethal could be a situation where it directly or indirectly contributes to a patient's death. So again, take a look at these. Again, always good to see some examples because these will be drugs that we'll be looking at later on in the class. So allergic drug reactions are obviously a thing that you need to be aware of. Again, these are hyper. So when someone has an allergic response, it's basically when the immune system has an over response to a substance. So it's basically a hypersensitivity reaction. Now, a majority of these reactions are unknown or poorly understood, so we don't know why they happen in a lot of instances. Someone can also have what are called pseudo-allergic reactions. So this is when an allergic drug reaction is not immune mediated. So essentially what happens with that is it kind of looks like an allergic reaction, but there's not actually an immune response that's taking place. Some factors that are related regarding allergic drug reactions could be the chemical composition of the drug, how the drug gets administered. Some of the very common symptoms related to allergic drug reactions. People that have asthma, they could have asthma attacks, and their asthma could become hypersensitive to something. Urticaria, angioedema, anaphylaxis are the big things that tend to happen when individuals have allergic drug reactions. So the provider has some options. They could either substitute something or just completely discontinue the medication. So that'll kind of be up to the provider to decide if there is, another drug that can possibly, produce the same benefit to what they're looking for. They'll either substitute it or just discontinue the medication. So managing drug allergy reactions, because this could be something that in the sports medicine setting you may run into. If a patient has just started to take a drug, you may experience somebody having this. So again, the first thing is to recognize the signs and symptoms of anaphylaxis. So again, in acute onset, know how to treat and manage that. And again, treat anaphylaxis accordingly. So again, a lot of drug, no drug classes where there's common reactions with as far as drug allergies. So antibiotics and anti-inflammatories, which are things very commonly used and that you'll run into in sports medicine settings. There's very common to have allergic reactions to those. And drug allergies are the second most common cause of anaphylaxis. So very important to kind of know and see this, recognize it. So the emergency drug used to basically reverse anaphylaxis is epinephrine. So that's going to be used to treat, because what that does is that basically reverses the bronchoconstriction. So the two big things that happen with anaphylaxis is you get bronchoconstriction, so the airway essentially basically closes up, if you will, and you get peripheral vasodilation. So the blood vessels in the periphery all dilate, okay, which then that, causes blood pressure to drop and basically decreases the diffusion of nutrients and oxygen through the blood. It is important to note that an individual can have what's called a biphasic reaction. That's when there's another reaction after the first. So the patient should be observed after having this. So even after having been treated with epinephrine, they should be kind of noted for that. And typically one of the first things that's most easily recognized are dermatologic skin reactions. So if you see a dermatologic skin reaction, that's one of the more common things seen right away. If that starts to get really widespread, that could be cause for concern. So in looking at the pharmacist role in the medication use process, so again, electronic transfer of prescription does enhance the safety of the whole process. Again, factors that could impact prescription decisions. So again, they have to look at the patient age, height, and weight, and that's to help to make sure that the proper dosages get calculated. So to make sure that the dosage is appropriate for the patient being treated. And then, enhance compliance. So we talked about compliance things later on. Again, communication, very important. Make sure that the patient's comfortable. So again, demonstrate cultural competence. Make sure the AT, make sure you as the athletic trainer, you respect the patient's wishes and advocate for the patient. So if there's some type of issue related to that, make sure you're able to manage that. The pharmacist and AT should reinforce the provider's information. So make sure that, again, the patient is educated how to take the drug, what are things to look out for. If English is a second language, make sure they understand prescription information. So again, that's one of the biggest issues that come about with medications, or errors in how the medication gets taken. Make sure they're aware of that. If possible, enlist family member support and assistance. That could be very beneficial as well. So this is a figure out of the book, and this just kind of outlines some drug information. So and whether they get a drug over the counter or they get a drug, many prescription drugs always come with pamphlets. Make sure that the patient is well aware of all the information with the drug. You see here on the drug facts. So this looks at this is basically taken from an antihistamine. It shows how the drug gets used, the warnings, when to stop taking it, ask a doctor or pharmacist. So this is basically saying, you're at the pharmacy and you're buying this. This isn't over the counter. This is actually an over the counter drug. Ask a pharmacist or a doctor if you're taking certain drugs that may possibly interact with it. They tell you some possible side effects and things to avoid. So these are all important things to look at. And again, also very important is how to store the drug. For instance, in this case, protecting the drug from excessive moisture. So this is all really important. And again, as a sports medicine professional, being aware of some more common drugs, some of these things you could help in communicating with the patient. Some other drug information resources, and these are very important for athletic trainers. Again, there's so many drugs out there. So to understand, again, our job is to understand some basic medical information around pharmacy services and to be able to support our patients. Okay, so again, there's going to be things out there that, even after taking this class, that you may still not have right away in your regular knowledge base, but you can certainly help with this. So pharmacy health literacy is very imperative. And again, this just doesn't mean trying to remember all of the different drugs and their dosages and everything, but how to access information is really important. So again, there's different types of ways that you can access information. So being aware of this. So there's a physician's desk reference, which is a good thing to have, and that's also available digitally. So these are basically some resources that you can use. I've used these professionally, even within teaching a pharmacology class. There's times I still have to look up certain drugs. Drugs.com, Epocrates. I believe Epocrates is an app that can be used. Medscape and the FDA can certainly use this. And again, keep in mind that frequently patients will access the same internet resources. So again, these are also available to to non-healthcare professionals as well. So patients may look these up or be curious. But as a healthcare professional, having these resources readily available to you in case you do have to look something up. Again, for the most part, you're probably going to become very familiar with certain types of drugs. Obviously, like again, for instance, anti-inflammatory, pain drugs, even like drugs to treat asthma, respiratory drugs to treat respiratory infections. You're going to become typically very familiar with those because you're going to be exposed to them a lot. But there may be other meds, and depending upon your work setting and your patient population, you may encounter some different medications. In other words, the medications you encounter working in a collegiate athletic department could be very different than what you encounter in maybe a more non-traditional setting, or maybe like an industrial setting. So those would be some things to keep in mind. So some other things for healthcare providers regarding, safety with drugs. The black box warning. So the black box warning is a specific method of FDA communication, and what that is again, it's based on safety concerns, and this is a specific warning that is in black ink. It is literally surrounded by a black box, and is highlighted in very bold lettering. And this is verbiage on a lot of medications packaging. Again, that's going to be really to alert about potential negative effects. And again, this must be included in both print and broadcast advertisements. And these are warnings that are based on adverse reactions, particularly more serious ones. So for instance, death and cardiovascular events. If you're talking about like with the gastrointestinal system, risk for possibly bleeding and ulcers, intestine perforation. So these are more concerning adverse drug reactions. And again, the FDAs typically want this to be communicated, particularly in the marketing phase of a drug. So again, this applies, as the drug's going through, is when the drug's applying for approval process in the early marketing phase. These are things that they want to make sure that they highlight so that patients are aware of these particular adverse drug reactions. And then again, drug to drug interactions. So anytime a person is going to take a drug and potentially it could impact another drug, for instance, if a diabetic drug diminishes, if they're taking a corticosteroid, methylprednisolone for back pain. So if that's the case, then a person taking diabetic drug may diminish the effects of that drug. So it's important to kind of, again, know these things, and again, make sure they communicate. And again, for the most part, individuals should be aware of this when drugs are getting prescribed. So in summary, again, high quality resources, and I went through some high quality resources that you can educate yourself with, and in the process of educating your patients. So again, for the AT, again, having a working knowledge of drug names, classifications, adverse drug reactions, and you'll see when we go over drugs, you'll notice, and I'll talk about this more, that like when you talk about classes of drugs, so for instance, when you're looking at antibiotics, different kind of classifications of antibiotics, they all have like similar things with their names. And that's one easy way to remember, certain types of drugs and what they do, and we'll talk about that more when we get into specific drugs and how they get used. But again, being aware of more common drugs, the adverse reactions associated with them, so that in the case you're ever, in a situation where a patient's having problems. But again, always make sure to keep an open line of communication. Make sure patients don't stop drugs, at the first sign of a very mild adverse event. Make sure that gets communicated with the physician. And again, stay as current as you can on prescription information, new prescription drugs. All of that will just be beneficial in your communication with patients. And these are your learning objectives for this particular chapter.